and welcome everyone. My name is John Medcoff and I'm the lead faculty here at the Canada School of Public Service. I'm going to be your host today and thank you for being with us. Les événements virtuels nous permettent de nous rassembler à partir de différents endroits au pays. Moi, je me joins à vous de la région de la capitale nationale d'Ottawa, alors sur le territoire non cédé du peuple algonquin Anishinaabe. Je vous encourage toutes et tous donc de prendre un moment et penser au territoire traditionnel sur lequel vous vous trouvez. Today, we are honored to welcome Dr. Theresa Tam, Chief Public Health Officer of Canada, for what I am sure will be a deeply insightful and rich conversation. Over the last several years, Dr. Tam has played a pivotal role in guiding Canada's public health response during times of uncertainty, including one of the most defining global events of recent history, obviously the COVID-19 pandemic. In this conversation, we'll explore the vital importance of intersectional action, so how collaborating across health, education, housing, the environment, and other sectors is really essential for advancing the population's overall health and well-being. As public servants, we all know that no single organization or no single discipline holds all the tools, and it's really only by all working together that we can truly deliver better outcomes for Canadians. Nous entendrons également les réflexions de la Dr. Tam sur l'un des défis les plus pressants de notre époque, c'est-à-dire la désinformation et la mésinformation. Nous connaissons tous qu'à l'ère de la surcharge d'informations, la capacité à séparer les faits de la fiction et à instaurer la confiance dans les preuves et dans les institutions est fondamentale pour une gouvernance efficace. La Dr. Tam parlera de stratégies pour faire face à ce paysage en évolution et ce que cela signifie pour notre travail collectif en tant que fonctionnaire. Un autre élément important dans la conversation aujourd'hui est l'ensemble des travaux de la Dr. Tam dans le cadre de la série de rapports de l'administratrice en chef de la santé publique. Il s'agit d'une collection de rapports prospectifs fondés sur des données probantes qui tracent la voie vers un Canada plus équitable, plus durable et plus soucieux de la santé. Ces rapports illustrent la manière dont la prévoyance stratégique et l'analyse fondée sur les données peuvent guider la réflexion à long terme et l'amélioration de l'ensemble du système. Enfin, et c'est peut-être le point le plus important, nous entendrons les conseils personnels de la Dr. Tam aux dirigeants et aux futurs fonctionnaires. Alors, comment rester ancré dans un objectif, comment naviguer dans la complexité et comment diriger avec empathie et vision. Je vous invite donc à vous installer, à écouter attentivement et à réfléchir à la manière dont ces leçons partagées aujourd'hui peuvent éclairer votre propre travail et que vous trouverez n'importe où que vous trouverez dans la fonction publique. So now, please join me in warming, welcomely, Dr. Theresa Tam.
Thank you so much. Merci beaucoup, Jean, de votre accueil chaleureux. Ouais. Je suis très contente d'être ici aujourd'hui. Premièrement, j'aimerais parler un peu de mon parcours professionnel. C'est une question assez fréquente. Donc, mon parcours professionnel a été marqué par des rebondissements inattendus, plusieurs défis et les apprentissages incessants, continus. Donc, je suis une immigrante. J'ai déménagé au Canada au début de 1990. Après avoir fini mes études en médecine en Angleterre. Ensuite, j'ai été jumelée à une résidence pédiatrie à l'Université d'Alberta. Et après ça, j'ai suivi une spécialisation aux maladies infectieuses. Et après ça, j'ai changé de cap, de direction de ma carrière vers la santé publique, le domaine de santé publique. Grâce à un programme à Santé Canada, j'ai obtenu un poste d'épidémiologiste de terrain. Je faisais des enquêtes sur le terrain. Donc, c'était une période très intéressante et bien sûr, à cette époque-là, je n'aurais jamais pensé devenir l'administratrice en chef de santé publique du Canada. En fait, ce poste n'était pas encore établi. Okay. Donc, c'était difficile de dire adieu à ma pratique clinique, mais finalement, je ne regrette pas de rien. J'ai une carrière très intéressante et c'est un honneur. C'est un honneur d'être l'administratrice en chef de la santé publique à l'Agence de santé publique. Comme femme immigrante, j'espère que je peux inspirer surtout les jeunes employés, les étudiantes, de devenir les leaders et les dirigeants au sein de la santé publique.
Merci beaucoup. I'll say, you know, we've all seen you on TV many times, but this is the first time I've really heard of your professional background and your journey to becoming the Chief Public Health Officer of Canada. So great to get to know you a little bit better in that context and maybe to set up some of the conversation that we'll have this afternoon. Maybe we can start just talking a little bit about the role. You've now been in the role, the Chief Public Health Officer, for 8 years, if I am correct. And would love to just, you know, learn a little bit more. I think we see a very public side of your role, but there's a lot more to it than that. Can you sort of talk to us a bit about what the role means?
Yeah, I'll talk a little bit about that. Peut-être en français. Comme la principale professionnelle en santé publique au sein du gouvernement fédéral, ma tâche principale est de conseiller la ministre de la Santé ainsi que la présidente de l'Agence de la santé publique. Je suis chargée de fournir des conseils fondés sur la science. Ça, c'est très important. Fondés sur la science et les données probantes. J'ai un rôle aussi de chef de file pour aider le Canada de se préparer pour les urgences sanitaires et à y répondre. En fait. Bien sûr, je communique avec le grand public par les interviews avec les journalistes, les conférences de presse. Mais aussi dans les médias sociaux. Et finalement, des publications en ligne, mes rapports annuels, par exemple. Mais je veux dire que la santé publique, c'est un travail vraiment en équipe. Je travaille étroitement avec mes homologues, par exemple les autres médecins en chef de prévention territoriale, les collègues internationaux et aussi le leadership autochtone, les communautés touchées par les enjeux de la santé publique, les enjeux en santé.
Vous avez parlé des rapports et si je ne me trompe pas, vous avez publié 10 rapports au cours de votre mandat. What did you learn from that experience of drafting these reports and thinking about the future of public health?
Well, it's been quite a journey, as you can imagine. 8 reports, 10 reports in 8 years, and I will be delivering another one this year, my final report, actually. What I found was, of course, each report is focused on a challenge that is really important for the health of the population at the time. But what I learned was it's the process, actually, that is almost more important than the final report, the final result. And the reason I say that is I find that I was able to take some action while developing the report. When the report was being published, I can leverage that to spark conversations, to catalyze collaborations after the publication. And I think what I learned was that if I, and this changed over time actually, if I made the process more participatory, more engaging with experts from all different areas of public health and other scientific disciplines, but also with First Nations, Inuit, and Métis experts and people with lived experience, then it gives the report more life and sustainability over time because people do see themselves being part of that journey. So I found that really quite interesting. And one thing I talked about really the concept of co-creating with Indigenous public health experts, for example, was one of the most important lessons that I learned during the last 8 years. I don't think I really quite know how to go about it at the beginning in the first report. But then I think I learned, I listened over time, and I hope people can take a look at those reports and see how, not just the content, but how that report development process has changed. And I think that evolved also because during this whole time, the federal government, for example, had the United Nations Rights to Indigenous Peoples Act to guide us. We had the Truth and Reconciliation Commission recommendations, and really I had to learn a lot about my role in upholding Indigenous rights and supporting self-determination. So I think throughout the journey, I'm most touched by the fact that I built trusted relationships with Indigenous leaders and elders, learned a lot about Indigenous knowledge systems and Indigenous science. I think that kind of trusted foundation is really important for us to move forwards, to tackle some of the complex challenges together. My own report sounded like a bit of homework that I have to do every year to Parliament. But it was actually, what I found was actually a really powerful platform. And I can give space on that platform to others with different voices as well. So I commissioned different reports, including an Indigenous-led vision for the future of First Nations, Inuit and Métis population and public health. So that was really impactful, I felt, on myself, on my team, but hopefully for everyone who might actually read this report, these reports and use them. Another interesting sort of approach that I took was, of course, I centered all of my work around health equity. And I did that because I knew that you can't take a one-size-fits-all approach to what we do, and that we need to serve people experiencing most inequities due to colonization, due to discrimination, due to system and structural, what we call the structural and social and economic determinants of health, these factors affect people's health outcomes. And those are the people that we need to really partner with and serve. So that theme goes throughout the report. But the reason why I went into public health was really because I think our health system needs to shift its focus from treatments, which is very important, into prevention and promoting healthy lives. And so, and I'm saying that because my first report was actually one on health promotion. It was focused on, the title was Designing Healthy Living. And it was to really illustrate and document how our built environment, how we built our cities, our communities, green and blue spaces, actually impacts our mental and physical health, access to food, access to services, and that if we took a health promotion approach, recognize inequities, serve the populations that need these supports and structures, we can attain population health. And so I used that report to knock on many doors and made many collaborations with other sectors like city planners at the municipal level. I reached over to ISDC Innovation and Economic Development Canada, IEDC. I'm going to get this wrong. ISED, right? I said, yeah. To see if I could help them with their smart city initiative, for example, which they were launching at the time. So it's just to illustrate how, these reports can help transcend boundaries and sectors and help us work together. And then my latest and last report on well-being is the same kind of concept. How do we all work together to work on things that impact people's quality of life and what matters to them? And that will, I hope, stimulate even more intersectoral work.
Okay. Thank you for sharing that with us, because I think we all see the report that comes out of it, but hearing a little bit about your approach and the thoughtfulness and the intent behind it, and also how your own thinking has evolved over the course of preparing those reports, I think definitely some things we can link back to all of us who work in the public service and the way we think about our work. Look, I think I mentioned early in my remarks how much the COVID-19 pandemic has been something significant that we've all been navigating. So I probably would be interesting to hear some of your thoughts on that. La pandémie de la COVID-19 a marqué une grande partie de votre mandat dans votre rôle. Et j'aimerais peut-être vous poser la question, qu'est-ce qui vous a frappé de cette expérience? Quelles parties de cette expérience vous ont le plus marqué, peut-être?
La pandémie de COVID-19 a été une période exceptionnelle pour tout le monde, en fait. C'était un événement le plus marquant des dernières 100 dernières années. Donc, je me souviens du premier email courriel que j'ai reçu de mon équipe avec la nouvelle inquiétante selon laquelle il y avait une grave maladie respiratoire à Wuhan, en Chine. C'était le dernier jour de l'année 1999, la veille de Nouvel An. Ensuite, de tout ce qui a été fait pour répatrier les Canadiens et les Canadiennes qui se trouvaient à Wuhan, les personnes qui sont à Wuhan à ce moment-là, en Chine, sur des navires de croisière, comme le Diamond Princess, au bord de la mer de Japon.
Ouais.
C'était un exemple incroyable de collaboration entre plusieurs ministères. Donc, à ce moment-là, nous n'avions pas encore réalisé l'ampleur de la dévastation qui suivait. Comme les personnes qui vivent dans les établissements de soins de longue durée, les personnes âgées, les personnes travaillant ou vivant dans les endroits bondés ou surpeuplés, qui sont plus touchés. Et je n'oublierai jamais les impacts, les répercussions graves sur les travailleurs de la santé. Les images des infirmiers, les médecins, les gens qui travaillent dans les soins intensifs. Un souvenir positif marquant est lorsque la première personne âgée a reçu le vaccin. C'était le 14 décembre 2020.
Wow.
C'était très émouvant parce que COVID causait des ravages dans les établissements de soins de longue durée. Et le premier vaccin, allait changer tout dans cet endroit. On ne pensait pas obtenir un vaccin si rapidement. C'était une collaboration énorme internationale entre les scientifiques, les secteurs privés, comme les fabricants de vaccins et les gouvernements qui investissaient beaucoup dans ce domaine. Et finalement, c'était un grand succès. La plus grande campagne de vaccination de l'histoire du Canada. Et le taux de vaccination pour les premières 2 doses était le plus haut de G7, du monde, en fait. Et le vaccin a sauvé la vie de beaucoup de personnes. Donc, notre réponse au sein de la fonction publique à la lutte contre cette pandémie était vraiment un exemple extraordinaire d'un travail en équipe de l'ensemble du gouvernement du Canada et de la société canadienne. Ce n'est pas uniquement une réponse dans le secteur de la santé, bien sûr, c'est une réponse dans le secteur social, le secteur économique, le transport, agricole. Donc, plusieurs personnes travaillent ensemble. Mais c'est les Canadiens et Canadiennes qui sont l'ingrédient très clé dans le succès de notre réponse. So, I think it is absolutely tragic that over 60,000 people lost their lives. But I think that amongst that tragedy, we could see, certainly for a good part of the initial response to the pandemic, people wanting to help each other, neighbors supporting each other, communities really coming together, and that's how we really were successful, I think, in addressing the pandemic. So, yeah, I mean, there's so much to say, really.
Can I maybe ask you just to go a little further on that, because you talked about all those big changes, all those big moments. what are the key lessons we can draw from that experience that you think we should be mindful of as we, think about the eventuality of a new public health crisis, of a new pandemic? What are the key things you would want us to take away from that experience?
Yeah, there's obviously, as I say, quite a lot of positive aspect of the response, but there's also some very significant adverse impacts, not just of the virus, but of the response itself that we mustn't forget. I think we mustn't forget that we're so focused, for example, in the health sector at least, on the actual health response. We need that whole society, all the different sectors, being capacity to respond and to contribute. Okay. For example, I think in the time of uncertainty, and such a massive societal challenge, there is never a black and white answer. I think that's one thing that we have to remember. Most decisions are taken by our elected officials are really difficult ones. They have to weigh the benefits, but also the trade-offs or the negative impacts of every one of those decisions. I think we need to do better at measuring those other impacts. Okay. In order to help us adjust the overall response as well. No pandemic is ever the same. So no two pandemics are the same. So I always said, if you've seen one pandemic, you've seen one pandemic. And so that's really important to remember, because we have to be able to adapt to what the next one looks like. So when you look at pandemics throughout history, some, like this one, impact older populations. But many pandemics actually impact younger populations. For example, influenza pandemics, many of it impact younger populations because they haven't had any experience with influenza in their lives. Yeah. That shifts how you're going to respond as well. The educational impact was very significant because local jurisdictions, many of them closed schools or went hybrid. That has impacts on kids and youth. But if the next pandemic was actually severe in the population, I think, people will actually respond differently, perhaps. We actually need to. So I think really the bottom line is to do not just think of the last event when you're responding to the next one. Look at different scenarios when you're planning and exercise them. Because you have to tailor your response, but you can practice different, trajectories, and most importantly, practice not just amongst your own team, but more broadly across government tables and across sectors. I think making decisions in a time of uncertainty and guiding people through a time of uncertainty is something that is going to occur repeatedly. So I think training people, enabling our leaders, our responders, and our workforce to know how to do that, how to work through uncertainty, and how to make decisions, take decisive action despite imperfect information, because that is absolutely going to be the case. In the science realm, let's just say, in say a department like, agency like ours, the Public Health Agency, is science-based. We were not well set up in our governance, in our committees, in our processes to enable research and data to flow, to be synthesized, to be mobilized to decision makers, to the public. We went from a data scarcity to one where we had a deluge of information, like 1 million publications in that first year, where we really, in the future, need to set things up so that we know who's going to help synthesize all of that stuff and figure out what's credible science, what's not, what has been peer-reviewed, and then pull it all together, analyze it, and then present it and make people understand it. It's actually a big system with different functions and capabilities that we really need to work out. There was a report by the Chief Science Advisor, and Sir Mark Walport from the UK actually did a report for the Deputy Minister of Health Canada, trying to provide some recommendations on how we do that. But communications, of course, is extremely, extremely important. So, you know, the good risk comms is say what you know, what you don't know, and then keep going back to communicate with people when you have more information, I think is something that we all have to be better at. We need to be informed by behavioral and social science to help us, whether the what to say, but also how to frame it and how to use participatory approaches. I think there's been a lot of discussions about the fact that there's polycrises. You know, it's not just like one crisis, but multiple ones on top of each other. Climate change, wildfires, heat domes, pandemics, economic crises. A lot of things might sort of just come together. And I believe, and I've written a report on it, that we have to pull our resources together and our thinking together to how to build community-level resilience. Every community is different. And if we don't do that at either geographic levels, but also communities that are linked by their social connections or their common experience, then we will not be in a good spot to address multiple crises. So I think the bottom line is we're going to have significant improvements in our technical capabilities.
Okay.
In the agency, we have better laboratories. We now have point-of-care testing. We have genomics. We're going to have AI-assisted, you know, technologies, wastewater surveillance, which people talk. So all of that, and vaccines might be developed in even faster if we can harness the sort of technologies as well. But I think, you know, the things that are more intangible are the need to build public trust. So, and that you need to build before a crisis happens. It's like a continuous public trust building. And really think through how do we do that. It's relational, it's being credible, it's making our processes more transparent, it is being more inclusive and participatory in how we do things in the public service or in other walks of life. So I think, yeah, build trust over time. What we can't envisage, because we don't know when the next pandemic is going to happen, is what will be the geopolitical landscape, our economic situation, for example. What would that be like? Well, that you may or may not be to control, certainly not from where I'm sitting. But I think that building the trust, ensuring people have what they need, and build that community-level resilience will stand us in good stead.
Two things, so much of what you said really struck me, but two things I'd maybe propose we could explore a little further. You talked about the challenges of making important decisions when we have incomplete or imperfect information, and you also talked about the importance of building public trust and the importance of and the value of public trust during these times of crisis. Et dans mes mots d'introduction, j'avais parlé un peu de la mésinformation et de la désinformation. Notre environnement de communication a beaucoup changé depuis le début de votre mandat. Je me demande si vous aurez des réflexions à partager par rapport à les défis reliés à la mésinformation, à la désinformation, surtout dans le secteur de la santé publique où les conséquences sont vitales. So anything you'd share with us on reflections about how that environment is evolving and how it influences the way we navigate these crises?
That's a really important question. I'm sure every department is grappling with mis and disinformation. And I think, first of all, it's nothing new, but it's definitely being amplified, accelerated by social media, by artificial intelligence, by what I would call commercial determinants, like the drivers of how these platforms work and the algorithms and how they're incentivized. So all of that is like an accelerant to mis and disinformation. And I'm sure, I think the listeners know the difference, but certainly disinformation is where someone deliberately, set about disruption, I would say, by sowing the wrong information into our society or our systems. Whereas misinformation is often done by people who maybe haven't spotted that the information is incorrect or not credible, but they often meant well. They're trying to maybe send something to their family members because they found that maybe it's interesting, So I think one thing I would like to stress is that there's actual data to show that mis and disinformation has an actual real and significant impact on our mental and physical health. So, and our safety and our well-being in general. So I was actually on a panel with the Canadian Medical Association, and they were just releasing their latest research through Abacus, which show that in the past year, people in Canada's exposure to misinformation has increased, their encounters. Those who use social media are the most vulnerable or susceptible to misinformation. You're less so if you follow, say, mainstream media. Okay. And what that did was the participants recognized it did have an impact on their health. It delayed or they avoided seeking actual medical attention for some of their illnesses or what they thought might be happening to them. So that is terrible. They reported mental distress, anxiety as a result of reading of this information. It's caused family discourse, lots of, varied impacts, but they're real, I think. That's important to remember. And so another point is that these harms often fall most heavily, most impactfully on, again, populations experiencing inequities. Less access to credible sources of information, less access maybe to a health provider who can give that information, less time to sort through the deluge of stuff that's coming across, our telephones. So I think tailoring some of the supports for different populations, different age groups is really important. Some of the strategies that I've been thinking about actually takes what I call a public health approach. Okay. One is you have to have the data and do the research, including leveraging AI, for instance, for social listening on the different channels to see what actually is going on. Do actual research. There's not enough research, I think, on misinformation, certainly not on the health side. There's lots of publications, but there's gaps in our knowledge of how this all works and how people react to them and the interventions. So then we have to detect and respond. So in real time, just like we have to detect outbreaks, same thing. You detect actual significant bits of misinformation, And you try and address them in real time as fast as possible. But that's a really difficult thing to do because it's kind of losing battle. Once it's out there, it doesn't go away.
Yeah.
So I'm more on the prevention side of the equation, which is a concept called pre-bunking, which is vaccinating people against disinformation, misinformation ahead of exposure. So we can often predict what might come down the line, given the experience of the types of misinformation that may arise. But one thing is sort of engage the community, let them know, say there's a vaccine. You know there will be a vaccine. Let them know about how regulations work, how are clinical trials done, how safety of vaccine is ensured before, you look at trials and data before the programs provided to the population. So just be very transparent about some of the ways in which science work, in which technology work, in which regulations and safety measures work, I think is really important. Then there is literacy. So science literacy, media literacy, again, more preventive approaches. Learning how algorithms are duping you, or how to not be susceptible to fraud, which is happening all the time. Who is behind this viral spread of information? They're often very enlightening, and when people know, they will be more resilient, I think, against it. Of course, I think people expect the government to have some oversight over the social media platforms. They certainly expect the government to address disinformation or actors who might be disruptive to our society. So that, I think, needs more work. It's a bit like, I would say, is when you're driving around, you put a seatbelt on your kids. And it's law. You try driving, kids are running around in cyberspace. There's not enough seatbelts and safety measures and helmets. And so it's that kind of concept. The other thing that research has been telling us is that healthcare providers, doctors, nurses, pharmacists, are still some of the most highly trusted people. And by people in Canada, so capacitating them with the information, the training, and because they will be the people who will be speaking with the general public. And I think finally I'm going to say that sometimes there are communities who just don't trust government and institutions because of past history, trauma, discrimination when they try to access hospitals. Then we're not the messengers. We need to support community leaders who are trusted by the community, religious leaders, indigenous leaders, elders, to be the messengers for their populations. And we tried a number of collaborations during COVID, which we are able to build on that front.
Merci beaucoup des stratégies intéressantes qui ont des applications assez importantes dans nos rôles de fonctionnaires quotidiens. Vous avez parlé de l'importance du leadership dans la fonction publique, mais également avec nos partenaires. That's maybe a good segue just to talk about leadership in times of crisis. You referred to that early on in your comments, and wondering if you would have any advice for leaders, at all levels in government about how do we lead during these periods of crisis, during complex and uncertain times?
I think that's a superb question because I do think that there's some adaptation in how we provide leadership in the current context. But first of all, I'd like to just stress that leadership can occur at any level and anywhere in the public service, and that leadership can be developed and learned. some people maybe, the phrase, they're born leaders. Well, yes, there are those. But many people can learn and develop leadership tools and competencies. So one picture I always have in my mind, where particularly when I'm responding to emergencies or crises, is that I see my role usually as a managing the emergency as the conductor of an orchestra. And I use that analogy, that sort of picture, because I used to play music or instruments. And I played in orchestras, and I recognize what the conductor does is of course, you practice together, practice lots, and people practice, more practice you do, better you're going to get. But the conductor is there to pull together many different teams. So the sections of the orchestra, violin, woodwind, is like your epidemiologists, your logistics teams, your lab people, your comms teams, your legal, etc. And they are all great at what they're doing. They're experts, they can play the music, they've practiced lots. What you're trying to do is bring them together. I have a score, which is my emergency plan, and I use that to conduct the teams. Hopefully we've rehearsed it and people know the roles. And it's a matter of trust between the conductor and all the people who are part of the music making. And then you have to have a really good ear. You have to have you're a listening kind of leader. You can see if something is out of tune or someone needs to be brought out a bit further in their, the brass section or something. But you're also there to interpret and adapt the music. When the conductor's waving their arms about and you don't know what they're doing, they're actually trying to invoke a different feeling to the music, slower, faster, different mood. You can do that. And a good conductor is able to trust their players, pull them together to produce a fine piece of music, which is a coherent response, and adapt to the context of the day. Secondly is, I always said, and people have remembered this, that humility is a capability. So especially in the times of uncertainty, nobody can know everything. Again, I talked about communication. Nobody expects you to know everything. It's better if you tell them what you don't know as well as what you do. But keep committing to learning from everyone and communicating. So the third thing is that leadership, particularly during crisis, is about sharing power. So, it is linked to working in teams. Sharing power means you don't have to, you don't feel like you're the deputy minister and this is how it goes and it's top down. No, the power is shared amongst many players. It's the provinces and territories that have the health systems. Public health is local. So I cannot do my work without collaborating with the chief medical officers across the country. I have to collaborate with other government departments. So really, and indigenous leaders and youth. And so it's about how do you share that power? And that will make your life a lot easier if you do, because nobody really can deal with complex situations by themselves. So maybe I kind of leave it at those. There's lots of, I just thought that, there's many courses for us to take on leadership, but those are just the way that I've adapted my thinking about leadership based on my own background and experience, really.
No, I love that because I think it links back to something we talked about earlier, that leadership comes from all levels in an organization. Whether you're at the beginning of your career, whether you're at the end of your career, that mindset is one that I think we can all draw some inspiration from.
Well, one more thing is that you have to be extra patient to everybody.
Oh, and tell us about that.
Because Well, you're stressed yourself, right?
Yeah.
And you imagine you're working day and night, but you might be frustrated with stuff, you're sleepless, but that's when you absolutely must be even more patient with your staff, your teamwork. It's just that's just check in, have people who are trusted around you to tell you that, by the way, you seem a little bit stressed out yourself, so that you can be generous and kind, I think, to those around you. I think that's really important.
Okay. Je vais peut-être vous poser une dernière question touchant sur le leadership. Évidemment, vous avez parlé de la complexité de notre environnement actuel, des défis à venir. Alors, d'où pouvons-nous, en tant que fonctionnaire, en tant que leader, où est-ce qu'on peut trouver la vision, où est-ce qu'on peut trouver l'inspiration, où est-ce qu'on peut trouver l'espoir pour relever des défis qui vont nous venir dans notre état actuel, mais aussi dans le futur?
Oui, donc, comme nous avons déjà observé durant la pandémie, ensemble, on peut faire des choses difficiles. Together, we can do really hard things. Something that I keep repeating to the general public. Build on our strengths, because in lessons learned, we tend to look at all the things that we don't do well, but there's a lot of strengths, and that positive way of looking at the situation and challenge is really important. And that's, indigenous teachings often talk about that too, is strength-based, positive, more positive-based approaches. Otherwise, we're not going to get through all these polycrises and other things together. And I talk about this in my reports as well. I try to persist in them so they are more positive, because we can have hope through action. And I'm answering this part in English because there's a quote that I wanted to leave with everybody from Sir Michael Marmot, who is from the UK, who's a global leader in health promotion. So what I said was, I'm not an optimist, I'm hopeful. If you're an optimist, you predict that it will turn out well. So you fold your arms and you wait, because you know it's going to turn out well. If you're hopeful, though, you really understand that it can turn out well. So you roll your sleeve and you act. So whether the result will turn out exactly as you wish, being hopeful means you can still act. And the important thing is to do it, to have a go. So don't give up, because anything that we do, certainly in public health, is an endurance sport. So it's like a marathon. And if we stood back far enough, like in my career, if I thought about what was going on at the beginning of my career to now, I can see progress. Okay. I truly, truly can. Women in medicine was not an equitable situation at the time. It is now. Okay. Maybe not in certain specialties, but we're getting there. Look at the deputy ministers. Mm-hmm. There's more equity now. There's a more diverse group of leaders. Mental health, I remember mental health was not talked about at all. We're not in physical health and heart and lung health or something. But now we talk about mental health, I think possibly because employers realize that mental health is important to their workforce and their productivity. And, so I think we now talk about it, even men talk about mental health. And what gives me hope is that I believe society has woken up to the past histories of Canada and the negative impact of colonization, residential schools. So there is momentum in reconciliation with First Nations, Indigenous, First Nations, Métis and Inuit peoples, which I did not see at the beginning of my career. So that gives me hope.
We've just got a couple minutes left. Anything you would like to add to that last message of hope as final reflections for our audience here?
Well, I think it is certainly an honor to be in the position that I'm in. Never thought I was going to, this is not how it was planned, but I really found that life is what you make it. The federal public service provided me with a purpose to wake up every day. This is what it's like, what it means to be a public servant, to serve the people in our country, and it's been hard at times, but it's also been an incredible experience, and I would not sort of switch it out for anything else, really.
Merci beaucoup de cette dernière réflexion. 60 minutes se passent assez vite.
Oui.
Enfin, ça conclut l'événement pour aujourd'hui. On behalf of the school, really, I'd like to thank you, Dr. Tam, for sharing your time with us, for sharing your wisdom and experience with us today, your very honest reflections on some of the challenges that you've seen in the course of your mandate, that hopefulness that you bring to it, though, and some things that I think all of us working in public service can really see in connections to the work that each of us does every day. You know, your messages around collaboration across sectors, across organizations.
Stop the silos.
Stop the silos, yes. The importance of communication and being honest, of doing that prevention before we think of the reaction. So many things that certainly in the jobs I've had in my career, I can see the applicability of all these lessons. Alors, un gros merci d'avoir partagé ces réflexions avec nous. J'aimerais également remercier tous ceux et celles qui ont participé à cet événement au cours du pays. We look forward to seeing you at future events in the Virtual Cafe series. Encourage you to visit our website to keep up to date and register for future learning opportunities. And with that, I'll just say take care, stay connected, and please continue the conversation. Merci beaucoup.